Hello, this is Dr. Simo Bay, and thank you again for joining us on this channel. Today, we will talk about the three things you should know about East Asian medicine. So, when we're talking about traditional Chinese medicine, which was created in the early 70s, it is based upon the classical Chinese medicine structure, which is 4,000 years on books called the Shanghan Lun and, in particular, the Wang Di Neijing. And so the nomenclature starts to develop as China was putting together a national medical system in 1970 71 with the CCP. And so that was branded for the world. Without it, we would not be able to practice in Europe in particular. But in particular, I would say the Americas in the United States in the 70s there. And so while East Asian medicine is more of a recent term that takes into account, various bias in terminology or just the misunderstanding of what this is. It also seeks to include an entire region, East Asian, Far East Asian cultures, which are so many different types of, again, we talked about traditional medicines from the South, from the North, from the East to the West, but it's generally an inclusive term which encapsulates the medicine. So the first thing is nomenclature, I would say, which is more, I think, forgiving than Oriental medicine, which has derogatory term in there, even though most may see nothing wrong with it. Some do. So it's about inclusion there. I think the second thing about East Asian medicine is that it has a history which is generally unbroken. Their lineages, as we mentioned in an earlier talk, that are scholarly, that are folk, and that are a more family lineage based. And so the history of East Asian medicine is quite profound and is highly accurate in these days and times. I think the third thing that you should know about East Asian medicine is that it has ancient tech for a future medicine, is what I like to call it. And that ancient technology is based upon being able to observe sun, moon, stars, the earth in which we live on, and observing in nature a particular type of what we call medical mathematics, which is in play even as we speak. And so innovation is happening right before our eyes for those who are able to see it and apply it to a type of future medicine that we will all be using very, very soon here. We know that the sun is changing, and it's changing a lot quicker than we may think. The earth is changing as well. And so it is imperative that we raise our chi, raise our consciousness, and become more than we know. Just to recap, the three things are, of course, the history of East Asian medicine, its geography, nomenclature, and then, of course, its innovation. Those are the three things that we know. So we say uh, the name is more inclusion, nomenclature, history, and of course, it's innovation. Those are the three things that I would say about East Asian medicine that you should know and participate, study, learn. It will change your life. Once again, thank you for watching, and be sure to remember to subscribe to the channel for more helpful information.